This is Dr. Jim Polakof, and welcome to another episode of Live Healthy Longer. Today's topic deals with one of the most aggravating and painful challenges that almost every one of us experiences. Are you aware that healthcare experts estimate that over 85% of American adults suffer from back and neck pain and sometimes during their lives? Oh, and pain is expensive. The general consensus is that $90 billion is spent annually on the diagnosis and management of low back pain, plus another $20 billion attributed to economic losses in productivity. However, for those who suffer daily from back or neck pain that hurts, regardless of medications, physical therapy, or chiropractic, how and where do you find relief? My guest for this episode is Dr. Cary Idler, a Board Certified Orthopedic Surgeon with the Bone and Joint Surgery Clinic located in Raleigh, North Carolina. The good news is that Dr. Idler is a leading surgeon in less invasively alleviating back and neck pain, oftentimes permanently, and with little downtime after surgery. I happen to choose Dr. Idler for this interview because, like many of you listening, I have fought back pain for years. I've tried physical therapy and chiropractic with little success. So after asking for recommendations from my physician friends, I chose Dr. Idler for a laminectomy. My wife was impressed that the procedure went so quickly, and I returned home the same day. In fact, within a couple of days, I resumed light activities, including computer work in my home office. So here I am, just a few weeks after surgery, conducting a podcast interview. Welcome, Dr. Idler. Thank you for joining.
Well, thank you for having me.
Now, many of our listeners have tried physical therapy. They've experimented with chiropractic. They've taken muscle relaxants, but nothing seems to work in easing, especially our low back pain. It still hurts like heck. So are there any non-surgical options left other than what I've more or less covered?
Yeah, you've covered most of them. There are injections, a variety of different types of injections, from trigger point injections to epidural injections, facet injections. A lot of it depends on where the pain generator might be coming from.
So let's say we try the injection route, and the relief, well, it's only temporary. It might last just a bit, may not even help at all. The pain returns. So now it's time, I guess, to consider a surgical remedy. So we're going to shop for a surgeon. Now, I know there are two types of surgeons that actually perform various types of back procedures, an orthopedic surgeon and a neurosurgeon. Can you tell us about the difference?
Sure. The training is very similar, except that with neurosurgery, they deal with a lot of, with brain issues along with the spine. Orthopedic spine surgery deals with the spine and then other body parts like hips, knees, shoulders, etc. Now, I think when you're looking around for a surgeon, whether it's a neuro or a big surgery, I think it's not so much the where the training was done, but it's the quality of the surgeon. I think that's really what it comes down to, and their experience level and their complication rates and that sort of thing. So I think that's much more important than whether it's neurosurgery or orthopedic spine.
So it's appropriate perhaps to ask a surgeon how many procedures that he's suggesting, that he's performed, and what about a second opinion? Is it wise to get a second opinion?
Yeah, no, I think especially when there's a lot of areas in spine surgery world that there are gray areas. When there is a gray area, then yeah, second opinions are helpful, and even when it's clear cut, it's helpful because just for peace of mind or whatever. But it can be helpful if you're But of course, if you have just a very clear cut problem, you like your surgeon, then certainly it's not always necessary to get a second opinion.
So your own comfort zone is pretty important. Now, Dr. Idler, as an orthopedist, How do you actually proceed with the patient in order to provide an accurate diagnosis and a recommendation?
Well, first of all, it's the history and physical is the two most important things. Onset of symptoms, the type of symptoms, whether there's neurologic symptoms are always very important, and not just simply back or neck pain. When there is some significant neurologic issue, such as radiating leg or arm pain, or symptoms such as that, numbness and weakness. When there are those types of symptoms, then we get a bit more concerned, as opposed to someone who comes in simply with like back or neck pain without any neurologic symptoms. So that's the first thing: is a good history. When do the symptoms start? Is it only we would call axial neck or back pain? Does it have any radiating components and numbness and weakness, those types of things? And then the physical exam. And so we test for sensation. We test for weakness, and also we often will test gait as well to make sure to see if there's any disturbance in how you're walking, looking for limps and coordination problems and that sort of thing. Because that would get us more concerned about pressure on the spinal cord, for example, or pressure on nerve roots, and we would be more likely to go toward getting more advanced imaging if
MRI, for example.
Yeah. And so initially we would start with an X-ray, typically, because we can assess alignment better, or instability issues with an X-ray, which you can't necessarily get just from a plain MRI. So we would start there, and then depending on what we find with the history and physical, we often would we would start, especially if there's no significant weakness or numbness and that sort of thing. We would often start with some medications like anti-inflammatories or muscle relaxers. That sort of thing. Physical therapy is always very important. Very often, physical therapy can be helpful, and so we often start there. And then if the symptoms progress, or after 4 to 6 weeks or so, and there's no improvement in their symptoms, then we go ahead and we order an MRI, or CT, depending on whether if someone can't get an MRI, we would want to get CT. And then and kind of go from there.
So let's say we'll use this as an example. I understand one of the common surgery for spinal stenosis is a laminectomy.
Mm-hmm.
How is this procedure performed, and is a hospital stay required after the procedure is completed?
The lamina is sort of the back part of the spinal column. It basically helps protect the spinal column, and there's sort of overlapping areas, and then in between those areas there's some ligament that connects the two, and very often the ligament contributes to the narrowing or the spinal stenosis, along with bone spurs, and then there's disc bulges that can all contribute to the narrowing in the canal. So there's a variety of different ways to do a laminectomy. The traditional approach has been a midline incision, typically kind of a wider incision to expose the lamina. And there's a miniature open where you do a small incision, a specialized retractor. And there's other techniques where you can use a tube and hold that in position. They're both very, very similar in terms of the exposure that you get.
But once you identify the problem that the patient has, then you're going to decide as a surgeon which approach you're going to take. So you have several options at your disposal, right?
Yes. Yeah.
So let's talk about the recovery. I mean, people are horrified sometimes about recovery because depending on who they talk to, recovery can take months, it could take a year. That's probably one of the nervous points of most patients. When it comes to a laminectomy, for example, what type of recovery are we looking at typically?
Well, it varies quite a bit, and it also varies or can vary based on the number of levels involved. And to go back to the question earlier, also typically for 1 or 2 level, I usually, most of my patients are outpatients, so you can go home the same day. If we go into like 3 or more levels, then we typically would want to keep you overnight for observation. But as far as recovery, it can vary quite a bit. Once that pressure is off the nerve, it typically will you'll see a significant improvement in the neurologic symptoms, the numbness, tingling, uh, symptoms in the legs or in the arm, and the incisional pain can last varying amounts from a couple of days to a couple of weeks. And then where most of the pain kind of dissipates, and then it could be a few months sometimes to sort of fully stabilize the symptoms. And we often find also after doing this laminectomy, some people develop an inflammatory response, and it could be from the little bit of bleeding that occurs, or just a response to the trauma of the surgery. And you can get sort of this inflammatory response where some of the symptoms may come back, temporarily, and we might have to, try some steroids to quiet that down. And that usually dissipates within a few weeks or so, if that should occur. Pretty straightforward.
So, in terms of spinal stenosis, that obviously we've been discussing that, but what other types of serious back pain, we'll get to the neck later, but serious back pain that might someone encounter? Are there other procedures for other types of conditions? Can we kind of go through those?
Well, so a lot of that depends on where the source of the pain is coming from. So a lot of pain that radiates to the low back, there could be a variety of different sources of that pain. One could be from the disc. It could be a degenerative disc. It could be from the facet joints, which are the small joints in the back of the spine that help stabilize the spine. When there's a lot of degenerative changes or arthritis in the back, those joints can wear out just like other joints, and they can become painful as well. Then there's muscular or ligamentous pain, and then there's also the possibility of maybe the sacroiliac, which is the joint that connects the pelvis to the spine. That can also sometimes be symptomatic, and they can all radiate to the same general area. So it's often difficult to try to differentiate where it's coming from. The exam can be helpful to try to differentiate where it's coming from. But often I would send patients to a pain management doctor to try injections. Like if I suspect it's a pain from the facet joint, for example, I would send a patient to the pain clinic to try injections in the facet joint. If that didn't work, they didn't give it any relief, then we'll try a different area, like try the sacroiliac. We'll try epidurals, those type of things, and see what works, what doesn't, and then we can go from there. The pain docs, in terms of non-operative options, if and they can do this for the sacroiliac pain as well, sometimes. But if we can determine that the pain is coming from like facet, from the facet or the SI, then they can do something called a radio frequency ablation procedure, where they just kind of run it's basically it's a wire that runs right alongside of the facet, and it will burn the sensory nerve that goes to the capsule of the facet joint. The capsule is sort of the covering of the joint that has all the nerve endings, or nerve endings in it. And so it basically just it ablates that little sensory nerve. It doesn't do anything with your muscles of your legs. It's just the sensory nerve to the facet joint. So that's an option, and a non-operative option as well.
So now, obviously, there are many possibilities when you're having back pain. What you have to do is pinpoint it. And perhaps from what you're telling me, see if I have this right, it's best perhaps to talk to an orthopedic surgeon such as yourself to decide how serious it might be. And then you might refer them out to physical therapy, or you might refer them to a pain management clinic, or you might, decide that surgery has to be done. But it sounds to me like it's a good option to begin with the orthopedic surgeon, decide what your, the possibilities are, and go from there.
Oh yeah, yeah. I think it's important to see someone who sees a lot of patients with these problems, because I think you get a pretty good sense of what is where pain could be coming from, and then make an assessment usually pretty quickly, where we think it's coming from.
Well, that makes sense to me. So let's talk about neck pain. What are the usual causes that you find of neck pain, and are there any non-invasive treatments to begin with that you could recommend?
Sure. Yeah. So very similar issues in the neck that you find in the low back, degenerative changes or arthritis, and then purely a neck pain problem. Then an X-ray would be helpful to determine to what degree that there are some degenerative changes, and then similar to the low back, physical therapy, and the physical therapists can do a variety of different things for both the neck and the back, but not just exercises and stretching, but they can do things like dry needling, for example, and other medications, anti-inflammatories, muscle relaxers, etc. If we determine that there's some neurologic involvement, however, then we kind of raise the bar on what to do next, and often we would want to get a scan, an MRI to determine to what degree there is some narrowing, and then we still would probably do some therapy, and maybe an injection also for that.
One question I have, which applies both to the low back, the back in general, the neck, is chiropractic. I hear mixed things about it. My question really is, can chiropractic sometimes do more harm than good? Is it preferable to really go to a physical therapist in terms of trying to work out whatever problems you have? Do you have any opinion on that, one way or the other?
Yeah, no, I think chiropractors can do a lot of good in most cases. I think that there's I don't have an objection to them trying. So especially when there is like muscular involvement and that sort of thing, it often can be helpful. Physical therapy is equally helpful. So often I typically would start with some therapy. Some patients have mixed feelings about chiropractors themselves, so some of them don't want to go and would rather go to the physical therapy, and vice versa sometimes too. So, but the data we have, kind of supports, the physical therapy, but the chiropractor can also be helpful. I mean, I have lots of patients come to me and say that they have been going to chiropractors. They're very happy with them for years, and they've been helping them. And then, but sometimes, if the problem develops to a point where, where there's, some significant narrowing or stenosis, and there's some problems with, some neurologic problems, that's where I think maybe, should probably, go to a surgeon or their doctor to work that up, because it kind of raises the bar in terms of like it can be serious. Yes.
Now, according to the CDC, 53.2 million Americans suffer from arthritis. How much does arthritis play into back or neck pain? And obviously, I'm assuming that surgery can't resolve the arthritic problems. What do you do in those cases?
Yeah, so um, arthritis, as I mentioned a little bit earlier, it's a similar process that happens with arthritis in in your other joints and hips, knees, shoulders, etc. So it's the cartilage starts wearing down, and just in the spine, the discs start to break down. And so initially, what we see on an MRI would be that the disc starts to desiccate. It starts to lose its water content, and it looks darker on the MRI. Then it can start to lose some height, and so the outer part of the disc can start bulging. You can start getting tears in the disc, and then pieces can push out, disc herniations. Um, like I mentioned, the facet joints can wear out, and then bones can start forming off the edges of the vertebral body where the discs are, and in the facets. All of that is what we consider to be arthritis in the neck and the back. So the surgery. So if it's like for example, if it's a fusion, you're just stabilizing that level. That disc, keep it from moving. And that often is what causes the pain, is that movement there from the arthritis. And just like a knee or a hip, when it moves, it hurts. So, but if you do a hip or a knee replacement, you get much improved pain from those procedures, and those are very good procedures. In the spine, it's a little bit different. The anatomy is a lot different, obviously. And so, we don't have if those facet joints are so worn out, we don't have a facet replacement, that at least one that works, sometimes a disc replacement, if you restore the height, it can distract those facet joints. And, I've done a number of those where, we've sort of, if someone really wants to maintain motion, we can still do a disc replacement in some cases, if so so long as it's stable, and there's not a lot of sort of degenerative changes. We could still do the disc replacement and maintain motion. That's the important thing. I'll add also that in a lot of cases, people who have really severe degenerative changes, where it's basically bone on bone, the disc has deteriorated so much that the vertebral bodies are literally touching, they often will just stabilize on their own. Like your body just fuses on their own. So we see that often as well. And then usually the pain gets better after that.
Well, that's encouraging. So unfortunately, we're at that point where we're just about running out of time, but I have one last question. We've talked a lot about surgery, which is obviously you specialize in that, but aside from accidental injuries, what can a person do to avoid or prevent major back or neck pain?
Well, I think exercise, keeping the weight down, don't smoke, healthy diets, that sort of thing, can be the most preventative thing. Among all of them, I think it's activity. We see folks that are overweight, and there's often they seem to be more affected by having more back problems than others. But there's also there's wear and tear. Everyone gets wear and tear as we age. To some degree, it's natural. It's just the normal aging process. But accidents, injuries can contribute. There's also family history or genetic component. There, we definitely see some patients with earlier onset of degenerative changes, and others who are well into their even 80s and 90s and have very minimal degenerative changes. So I think there's a combination of all those things that contribute to it. And so if you are fortunate to have parents that have don't have never had any back or neck problems, then be thankful for that. But others who have strong family histories often find themselves in our office a little sooner.
So, in terms of, and you mentioned activity is probably the number one resource in terms of, basically preventing back problems. What types of exercises do you favor? Do you favor working out at the gym? Do you favor aqua, swimming? Do you favor exercise bikes? Suggestions in that regard?
Yeah, so I think core strengthening exercises can be probably the most helpful. The exercises that strengthen the stomach and the back muscles, they can help stabilize the spine to some degree, and they can be the most preventative type of exercises. Now, in terms of like impact exercises such as running versus other exercises, we find that people with a lot of back problems, running can be difficult. So the pool is definitely an excellent option where you can get good exercise, good aerobic exercise. The bicycles is another one, recumbent bicycles, where you can get very good exercise without stress on the back. But in terms of like weightlifting and that sort of thing, that's something that where a visit with a physical therapist can be very helpful. They can show you some of the safe lifting techniques and things that can keep you out of trouble and getting an injury in the back. So keeping as fit as possible and keeping the weight down is probably the best preventative thing.
Dr. Idler, you've been a wealth of sound, helpful information. And so on behalf of myself and our listeners, I want to sincerely thank you for sharing your knowledge and expertise. And again, on our website, we're going to post how people can reach you if they need to at your clinic. So I rather thank you very much for being with us.
Well, thank you very much for having me.
Be sure to visit our website, jamespolakof.com, to learn how you can reach Dr. Cary Idler at the Bone and Joint Clinic of Raleigh. You will also find other great podcast episodes along with some terrific blogs. That's jamespolakof.com. James, Polakof.com. Now back to Dr. Jim.
As promised, here are my 5 tips to help prevent neck pain. Number 1, try a new pillow. It's best to use a pillow that keeps your cervical spine in neutral alignment, meaning the natural curve of your neck is supported and maintained. Number 2, try sleeping on your back. Some people with neck problems find it helps to sleep on their back and place a pillow under each arm with the idea that supporting each arm takes strain off the neck. 3, be sure your computer monitor is at eye level. So sit comfortably in front of your computer and close your eyes. When you open them, your gaze should be directly towards the top third of your computer screen. If you find you have to look down, then you need to raise your monitor up. 4, exercise and stretch your neck. Keep your neck muscles strong by doing short sets of strengthening and stretching exercises throughout the day. Number 5, carry weight evenly. A common mistake people make is to carry a heavy purse or a briefcase on one side of their body. This lopsided load can cause your shoulders to become uneven, straining your neck muscles. I actually have 5 more tips to prevent or alleviate neck pain, but you're going to need to go to my blog on the jamespolakof.com website to read them. Again, that's jamespolakof.com, where you can also listen to over 50 of my podcast interviews. In any case, thanks for joining me. And remember, a new episode of Live Healthy Longer happens every week. This is Dr. Jim Polakof. Have a healthy day and find ways to live happily.